Do you think that getting a younger looking face is just a procedure away? Think again, because today we're diving into the facial rejuvenation techniques that can actually make you look older than when you started. You might be doing some of them right now, so stay tuned to the end and you're not going to believe what we found out about fillers. A popular procedure that I see that has a lot of mistakes if it's not done properly is buccal fat removal. The reason is the buccal fat is in this area, and then right next to it is your masseter. As people get wiser or older, you get more boxy. If you take out the buccal fat and you leave an enlarged masseter, it actually makes you look more boxy and older. It's a very hard thing to repair. If you go to an expert plastic surgeon, you can repair too much buccal fat removal, but it can definitely make you look older, and it can make you look much older as you get older in proportion. Another big change that could make you look older is when you have somebody doing a laser procedure or an energy procedure like ultrasound, microneedling, things like that, when it's really not indicated. It's the old hammer and the nail thing we always talk about. If you have one device, you're going to try to make everybody fit in that device. If you have lots of different options, you're going to usually get the best option for your condition. There's two broad categories to think about. There is camouflage and there's correction. Camouflage is when you really don't need a lot of correction and you're getting procedures to kind of give you that glow and spice things up. But if you have a procedure that's designed for camouflage and you're trying to correct, it's going to actually make you look older. And the reason is it's going to change your pigmentation. It's going to pull down your eyelid skin and make your eyes have a different shape. It's going to make things distorted, which means you have higher volume in one part of your face, lower volume in another part, and it doesn't give you facial harmony. When you have facial harmony from top to bottom, that's what makes you look good. That's what makes a person look beautiful. But if you're disharmony in your face and your proportions, you're going to actually look older. Medical grade tattooing is another challenge that I see that's very hard to deal with. It sounds great. Get out of the swimming pool, you get out of the shower, you don't have to put on makeup, but the challenge is it looks good for a couple of months. Then it starts to migrate, and then it starts to fade and change color. And as a person not only gets older, does it migrate even more, but when we go to sleep at night, gravity stays awake. So what happens is you have eyes that appear older than they actually are. We've all kind of joked around about, grandma or somebody that's drawn in their eyebrows and their lipstick and they're running over. Well, that's what happens with medical grade tattooing. It does not stay still. Your skin is always turning over and changing, so it's guaranteed to migrate. And when it migrates, you look older. As a specialist that's quadruple board certified, ophthalmology and plastic surgery are part of those boards. And the most critical place that anybody will have trouble is around the eyes. When I'm teaching my fellows, I like to say a millimeter is a difference between success or failure when it comes to the eye area. And what I mean by that is you have this little hammock, almost like a belt, that supports your lower lid and your cheek region. If those do not have the proper tension, then it can pull down a little bit. One of the most common mistakes I see is people take out skin. And there's no reason to take out skin. What it's going to do is just pull your lids down. You know how you've made a smiley face and you change the eyebrows? Well, it's the same thing. If you change the angle of the eyelids and your eyes, you look completely different. So what happens is you go in to have a procedure to help with some bags and some skin changes. And then when you come out, you actually look older. I have people come to me all the time that say, I went to have my eyes look better and they look worse. And the reason is they're down slanted. The corners are rounded, and they look pulled, because when a person is lying on a table, an inexperienced surgeon thinks it looks perfect, but they're not accounting for gravity and tension and the actual dynamics of the tissue in real life. What you see on the table when it's still is not what you're going to get when you're up and running around after you've healed. So if you want your eyes to look younger and improved and not older, keep this in mind. I like to say it's not your grandma's facelift anymore. People, unfortunately, still do what I call an old-fashioned facelift. What I mean by that is you get scars in front of your hair, scars all the way down in front of your ear, scars behind, and scars down here. If you measure the scars, it's actually 70 centimeters. You can have the same facelift with no scars, and it's about 6 or 7 centimeters of incisions completely hidden in your hair, under your eyelid, or through your mouth. That's kind of a modern, or what I even call the future facelift, because a lot of people aren't doing it. The thing about an old-fashioned facelift that to me is just so objectionable is they shorten your sideburn. So you see people's hair start above their ear. If they do the incision in the hair and pull everything back, you have this huge space where your hair has been shifted. You have scars in front of your ear that are discolored. You're taking cheek skin and putting it on ear skin. The circle around your ear, the opening of your canal, and what's called the tragus gets all distorted. Your earlobe changes. And if you put your hair up, you have scars on your neck. There's really no reason to have an old-fashioned facelift. It's gonna make you look older, and if you don't like how your grandma's facelift looks or your mom's facelift, then don't have an old-fashioned facelift, because you're gonna go in trying to look better and more refreshed, and you're gonna come out looking older. Another one that I see that's just so disappointing is Botox is used by everybody from a podiatrist to a veterinarian to a dentist, and certainly family practitioners and OBGYN and people that don't live around the face and deal with the anatomy every day. There are courses where you could say this dot, but everybody's different. Make sure that you're doing it with somebody experienced, because if you don't, what happens is you'll have what I call spot brows, or you'll have puppy dog brows where it's too heavy. If they put it too deep and in the wrong place, it can migrate to your eyelids, and your eyelids will be heavy, and it's just not a refreshing look. You actually look worse than when you started. Botox is a great drug, but make sure you go to a great provider. It's like a can of paint. You can make graffiti or you can make a masterpiece. You want your own face to be a masterpiece. The other one that makes you look older if it's not done properly is fillers, and that's a big one. The cheek and lower lid area is very complicated. We've got ligaments that are shaped like a comma, and there's a potential space. And if you get edema, which is swelling in that space, you end up with this little comma called a festoon. When I go in for surgery and I have to repair these things, there is filler all in these potential spaces because people don't understand the complicated anatomy, and they think that you just put it in a certain area, but there's several layers in the skin. The ligaments, the muscles, the fatty tissue, the arteries and vessels, the nerves. You could think of it like a Big Mac sandwich. It's not just a piece of meat and bread. There are layers to the skin. So if you don't want to look older, make sure that you don't get filler by somebody that's just doing it because it's the in vogue thing to do. There's a reason that there's med spas on every corner, just like there used to be Starbucks on every corner, and it got more consolidated. You're going to see the same thing with med spas. Half of the ones you see right now will not be in business in a year or two because they're going to have so many complications.